Children should be getting dental care as early as possible. When mothers are pregnant and they happen to be my patient, I'll just start talking about proper nutrition for the mom, right? Because I want the baby's bones and teeth and general development. I want it to be ideal, right? I want that to be a beautiful, healthy baby. So that's kind of where it starts. I'll start talking to mom about maybe if she's thinking about breastfeeding the baby. I am a strong proponent of breastfeeding for the many benefits that it has for the baby and for the mom, especially, you know, when the mom and the baby can do it and they can do it well. Hopefully being breastfed and then being weaned onto regular food. I try to make recommendations, and I try to be there for the mom to make recommendations as far as how the baby should start eating solid food. I definitely recommend baby-led weaning. I think mom should breastfeed for as long as possible, hopefully up to a year. And the baby should start to try to eat semi-solid food. That is kind of how I like to start to make recommendations to mom and baby. The first time the child should start coming into the office for an appointment is maybe with mom, when they're maybe like around 3 or 4 years old, and the baby or the child might like sit in a corner with a book or something and just watch mom get her appointment. Her cleaning done or her filling, and mom is usually not going to be nervous and mom's going to be calm. And you know what, I'll come in, and if Raul is seeing that patient, or if one of our hygienists is seeing that patient, I'll usually come in and meet the child. I love children, so I'm usually, if there's a baby in the office, I usually come and take a peek at it. I'll maybe give the child a toothbrush, or, you know, I'll try to develop some rapport, because I want them to not be afraid of the dentist. I don't want a child to be afraid when they come to see me. Then maybe for like a real appointment around age 5. I think that's ideal. We try to do as much as we can around that age. They usually are in some kind of school, in preschool. They're okay with dealing with a little separation from mom, and you know, I can just step in, or the hygienist can step in and take good care of that child and give them a good experience. And you know, we try to treat that child like if it were one of our own, or like we try to remember what it was like when we were a kid and we might have gone to a scary place. We try to make it not so scary, and we just try to teach the child, or show the child exactly what we're going to do in a way that's not scary. We let them know it's going to be done quickly. And usually, you know what, when the child knows what's going to happen, and they know you're going to take care of them, and they kind of just get a sixth sense about it, and mom trusts us to see that child, they usually end up having a good experience. And you know what, children should come to see us about every 6 months, unless something is wrong. They should come sooner. And at home, they should be brushing their teeth. I tell mom and dad to get them an electric toothbrush. I tell them to get the noisiest one, and the one that vibrates the most, and the one that is their favorite character or color, because I want the child to use at home something that's similar to what I'm going to use at the office. So by the time they come to me, they're not afraid of maybe something that makes a little noise, or something that kind of like bumps around in their mouth, you know. And I want them to use some toothpaste. I want them to be able to like tolerate a minty taste, or like a fruity taste in their mouth, because that's the type of stuff that I'm going to be using in the office. So the idea is, you know, that when they come to see me, I don't want that to be the first time that, you know, that they come and see us in our gowns, or in our scrubs, or in our white coats. I want that to be a time that, you know, things kind of look familiar to them. And I want our office to be a place that they know, and that they're not afraid to come, because they've come before and they've had good experiences.